All right, so on this first segment of the program, we're going to be looking at Valentine's Day, which is 2 days away from now. But the information goes much beyond Valentine, and it talks about health and safety for you and generations to come. So we're talking sex and Valentine, preventing sexually transmitted infections and unwanted pregnancies. Well, my guest will be able to give us a guide on what all this is all about. Dr. Nkemjika Obi is a nutritionist consultant with Octosoft Technologies Limited. And she's right here in the studios. Nice to have you in the building, madam. Good morning.
Good morning. Good morning, everybody.
And how are you doing?
I'm fine. I'm happy to be here.
Wonderful. First off, Octosoft Technologies. What do you guys do?
Okay, so Octosoft is actually is a tech space, but we also focus on telemedicine. Telemedicine is something a lot of people don't really know about.
Okay.
It's a space whereby you could actually talk to a doctor at the comfort of your home.
Right.
Yeah,
Just put in a call through.
Yeah, just put a call through, send a text message or a video chat, and you could actually speak to a doctor. Now, the feeling whereby you go to the hospital, you have to wait a long time in line before it gets your turn. But telemedicine makes it easy. You could just take the way at which you take your phone to chat with your friends on WhatsApp. You could actually take your phone and chat with the doctor. You can actually share pictures with the doctor of what is the skin condition in your body, what's going on with your head, and the doctor will actually tell you what kind of medication you could take.
Wow.
Easy and fast.
And how long have you guys been in existence?
That's about more than 2 years now.
2 years.
More than 2 years.
Wow.
Yeah.
And where are you located? In Lagos or across the country?
Yes, we're located in Lagos. But the good thing about telemedicine is that wherever you are, you could actually talk to a doctor. That's
anywhere.
the amazing thing.
All right.
Yeah.
All right. Let's jump in on the conversation. 2 days from now, we'll be marking Valentine's Day. And I know you guys are coming up with this particular topic because of the hype and the rave that goes along with Valentine. Is that correct?
Yes. It is a topic that needs to be discussed. Valentine's Day is a day whereby you share gifts, you share sweet messages with people, but it's also a day whereby people make the wrong decision, which can affect their health and them and future. So focusing more on intimacy, love, relationship, and unintended pregnancy is very important. It's something that needs to be talked about in the society.
Okay, so is there a fact check or is there a data that shows that on Valentine's Day, intimacies, love relationships are of higher?
Well, there is no data per se, but at least we get to see people that are called November babies.
Okay.
There are chances at which on Valentine's Day
they might have been conceived.
They might have been conceived around that time. Yes.
All right. So, what are STIs, sexually transmitted infections? And
okay.
Let's reflect on that. Go ahead.
Okay. So, STI, of course, sexually transmitted infection. They are infection gotten when you have unprotected sexual intercourse with your partner, and it is so broad that a lot of people really don't understand the types and preventive measures. Okay, so we have two things when it comes to STI. We have the bacteria cause and we also have the virus cause. So I'm just going to make it quick.
Right.
For the bacteria cause, we're talking about gonorrhea, we're talking about chlamydia, we're talking about syphilis. For the viral cause, we're talking about herpes, we're talking about HIV, we're talking about HPV, human papilloma virus. Okay, and then of course, before I forget, parasitic. One of the common one that is being mistaken to something called yeast infection is called trichomonas.
Trichomonas.
Yeah. Yes.
Okay.
Yeah.
That one is mistaken as also.
Yes, yeast infection. A lot of ladies, they have the same symptoms of trichomonas, and they'll be like, "Oh, doctor, I have yeast infection. I think it's yeast infection. Give me medication for yeast infection." I'm like, madam, I think the best thing to do is for you to run a test for us to confirm that.
Right.
Yes.
All right. So unprotected sexual intercourse could lead to any of these infections?
Yes, unprotected sexual intercourse will lead to these infections. When it comes to Valentine's Day, everyone, there's a pressure in the society whereby they feel like Valentine's Day is all about intimacy.
Right.
This is the time where I have to show my boyfriend, this time I have to show my girlfriend, like glass balls,
Right.
Yeah, but they fail to understand the preventive measures to follow in this aspect. They feel like there's some people now that feel like whenever you're having intimacy, for you to prevent pregnancy, you
Right.
have to do the withdrawal method. But I'm telling viewers right now, please avoid that now. Now, for
You
preventing,
mean withdrawal doesn't work?
it doesn't work.
You mean it?
It doesn't work.
But some will tell you, I've experimented it and it has worked.
Well, God really, really, really made sure that nothing happened afterwards, really, because
So
it doesn't
you're
work.
putting it to the God factor now.
I have to put it. Everybody's a Christian, right? Yeah, there's Christianity, there's Muslim, and everybody know that it's God that has been saving us, because a lot of things are happening that we don't know about. Most
Right.
doctors know about, and it's been God that's protecting a lot of people.
All right. Okay, so are you preaching now that on Val's Day, youths and everybody who is going to be involved in any kind of relationship should practice abstinence? Is that it?
So abstinence is 100%. But I'm not saying that they should practice abstinence. You can actually use a preventive method called condom. Everybody knows what condom is, right? So you should use condom. Condom is actually at least 99% preventive.
Yeah, but some would say maybe due to my cultural or religious beliefs, I cannot make use of condom.
Well, you need to practice abstinence then. Another thing is for ladies, when it comes to preventive measures, in case you are in a committed relationship with your partner, I mean, if you practice unprotected sexual intercourse, there's something called emergency contraceptive pills, which works within 72 hours. So people actually make the mistake after 72 hours, they feel like they could actually take it. And all. So that's another preventive measures that people can actually take in order to prevent pregnancy.
Right.
Yeah, but it does not protect you against STI.
Okay.
Yes.
So what are the dangers of these STIs in the body? Let's talk about that.
Okay. So now, STIs, one of the danger is we are involved in our reproductive. It involves our reproductive system. So one of the dangers is infertility. There are some people that actually have one of these STIs with no symptoms and they feel like they're fine, but there are still some changes they notice in their body and they end up not treating it. So over time, these bacteria tend to grow in our system and actually cause harm. So when people are trying to get pregnant, they notice that it can't even work out because of this prolonged bacterial infection that has not been treated. Yes. Okay. Another thing is that when it comes to infection like the viruses, for example HIV, if you are not careful, it's suppress our immune system, which lets one to be affected by environmental factors. You see people that they get infected easily by the flu viruses. They get infected. They're infected by things like environmental bacteria, whereby injuries is not healing very well. They start having respiratory problems. They start having some interference in their brain functionalities. Right. So it's very important to ensure that you always get tested whenever you have any of this exposure to this STI.
All right, these STIs are just secondary kind of symptoms that begin to show or manifest?
Okay, so common symptoms that tend to manifest when it comes to STI are, for example, for women, abnormal vaginal discharge, painful urination. For men too, painful urination, so abnormal discharge from their penile region. Okay, and there are some cases people tend to start feeling feverish, unexplained weight loss, can tend to occur in all of this. And some cases, blisters around the genital regions, itchy around the genital regions, which can turn into sore. These are common symptoms that tend to, yes.
I've seen something here like dental dams. What's that?
So it's happened actually. and commonly when it comes to people that have most of these viruses, for example, HIV, it can tend to occur.
Right.
Even that something called oral candidiasis. Okay, you see whitish patches around the tongue region.
Wow.
Yes.
So these are signs that would show.
Yes, this is a sign, but it's over time. It tends to come out.
All right.
Yeah.
Dr. B, let's reflect now. So Friday, it's a day that we're supposed to be exchanging gifts, and you want to show your loved one or two things about how you care and all of that. So are these kind of discussions one can have on Valentine's Day?
Okay, yeah, these are discussions that one can have on Valentine's Day. When it comes to relationship, right? Relationship should be about something. It is committed, whereby you could actually talk to your partner. So if you want to make up your mind to actually be in a relationship with somebody, it means that you're open to have sensitive conversation with them. Okay. So Valentine's Day is coming, you know that, it's a first relationship and there are chances that this might go down. So it's very important for you to be in a relationship with somebody whereby you could actually have that kind of conversation that we need to use.
So the communication should be that, even if we're going to go into this has to be done in a very, very reasonable manner.
Yes, in a very reasonable manner. Yes, exactly.
Okay. So, I mean, for a girl or let's say lady now and a guy who about doing that, this is perhaps their first meeting and perhaps they want to go into that because it's Love's Day, so to say. So what should the conversation be like? I mean, are you safe or what? What should the conversation be like?
Okay, so of course, like let me give an instance. So a guy and girl, they're in a relationship for the first time and they're about to have this consensual intimacy. Yes. So of course the lady will be like, I think in order for me not to get pregnant, I think it's best for us to use the protective measures. I could get condom as I'm coming home. And the guy will be like, okay, why are you scared? I'm clean. I'm all like, no, it's not all about being clean. It's all about us preventing me from getting pregnant and preventing the risk of having STI.
Right.
Yeah.
Let's talk about Octosoft now. So is there any application that can really guide one through all of this?
Yes. So you have to download the app called Octodoc.
Okay.
Or you could
Octodoc. That's OCTODOC.
So or you could go to the website www.octodoc.com, or you can download the app Octodoc. Okay, it's also on iOS and Android. Yeah.
All right. So what are the features that one would say with this Octodoc?
Okay, of course, in the app, we also give some educational features there. You can see it's now blog space. And then also, you could also consult a doctor. You can speak to a doctor. If you want to even speak to a consultant in gynecology, you could also, there's also features there. You could actually speak to one over there. And also, very soon, we're going to bring up something whereby one can actually get tested at home. Whereby you get a kit. It's a kit whereby you could test for HIV, gonorrhea, chlamydia at the comfort of your home. And then for you to discuss the result, you just need to consult a doctor via our app, and we'll discuss the results. So if it's a case whereby you are positive, we'll tell you the medication to use. So life should be easy, and Octodoc has brought a solution to Nigeria whereby that you can actually talk to a doctor at the comfort of your home.
All right, there's a message here for you. It says, can STIs be transmitted through oral or anal sex, or is it just the normal intercourse? Thanks. This is Fisayo sending this one in. I didn't want to make use of the word that was sent here. Right. So is that possible?
It is possible. Now, I mentioned about the virus causes. So for herpes, okay, when someone is at the stage whereby there's a massive breakout and they have the herpes in their genital region, right? When one is getting involved in that, there are chances that it can be transmitted through oral means, okay? And also, yes, like you said, the person asked about the anal region. It is possible.
It's possible through the anal region.
Yes, okay, it is possible.
I hear that's becoming a trend now.
Yeah, because there are chances at which one can actually have tear, and of course blood spill, and there's exchange of fluid. So definitely one can actually get it.
All right, this one says, Dr. Nkem, a lot of parents struggle with how to start the talk of sex and intimacy. So, what's the best way to bring up STIs? Okay, so struggle to. So, what's the best way to bring up STIs and pregnancy prevention with a teenager? Ngozi is sending this one in from Ilikweju. Ngozi, thank you so much for that one. So,
thank you so much for that question. I remember being very young when our mothers would tell us that when a man touch you, you easily get pregnant.
Yeah.
Please, as a teenager, I feel like they are old enough to understand certain things. There are a lot of people that...
So those kind of myths shouldn't be brought on teenagers?
Yes, it shouldn't be brought. It shouldn't be, because they have curious mind. Their hormones are rising, so they want to try a lot of it. And let's not forget, they actually watch movies. Yes, there's Netflix there is Prime videos there, so they watch all of this. So it's very important for parents to actually have that conversation.
And it should be done straight to the point, right?
Yes, it should be done straight to the point. Let them understand what are the risks.
Right. This one says, good morning. Please, I have 2 questions. Firstly, can 2 people who have never been with anyone else still get a sexually transmitted infection? And does washing after sex help prevent infections or pregnancy? Thanks. Aramide is sending this one in.
That is a very wonderful question. Thank you for that, Aramide. Okay, so there is this myth that I need to debunk.
Okay.
That after sexual intercourse, once you go and wash yourself, you are free
clean
from all of this. Please, I beg of you, do not even think about that. Now, for people that have never had intimacy before and they're doing it for the first time, of course, if one does not have any childhood diseases, for example, there are people that are born with HIV and all from childbirth.
Right.
Yeah, if they don't have any of that and all, of course, you're not going to get STI. Okay. Yeah.
All right. So that debunks that for you.
Yes.
All right. This one says, if parents suspect their teens is in a sexual relationship, should they confront them or wait for the teen to bring it up? Mrs. Bassi is asking that question. So what should they do?
Of course, don't wait for them to actually bring it up. I mean, if you notice it, definitely you should have that conversation with them in a very calm and, according to our Gen Z, in a very demure way. Okay,
that's the word. That's the word. Demure. They should do that in a demure way, right?
Yes.
Okay. All right. Let's begin to round this up right now. So for those who would like to connect with Octosoft, how can they connect with you?
Oh, you can actually download the app, like I said, and book a consultation. You see the different doctors. You also see me there. If you want to have a consultation with me, you could actually see me there and then click and then book a consultation with me.
All right.
Yeah.
It's nice having you on the program this morning, Dr.
Thank you.
All right. So you guys, as you celebrate on Friday, think about Dr. Nkemjika Obi. She's saying, please do this with some caution and think about your health as well. Do not rush into anything because of the gifts or perhaps the monies that we showered on you, Ravi?
Yes.
Please say it again. Your parting thoughts. What's your parting thoughts to our listeners this morning?
Okay, so always remember that prevention is better than cure. Okay, it's better for you to know the preventive measure than for you to have it and then start looking for cure. So it's very important.
We'll leave it at that for now. Thank you so much for being here.
Yeah, thank you for having me.
All right, a brief break. When we return, we'll do our birthdays before we switch to maritime today.